it says chat's working. So fingers crossed. The messages show up today. How's everyone's Friday going? Are we just another day in the apocalypse? Anything crazy happening? Nothing crazy happening? Is my sound even on? Hello, Keith. All right, I finally see a message showing up. They're coming through over here. Can you hear me? Yes, we have sound. Cool. Okay. Otherwise, this would have been just, a lot of me just talking at a computer screen, which, very sad. Very sad. Let's see. Melissa says, good morning. Wherever you are in the world, I'm guessing it's morning there. Saturday morning over in Australia. Hello over in the future. People messaging in from Houston. How are you guys doing out there with a little dump of rain that I hear you? Is everyone? It seems like my mom, Mom, hath entered the chat. How are you guys all doing out there? Because it's been a little bit of a rough week all around the U.S. And it's all my love going out to you guys who are. It's both in Wisconsin and down in Louisiana, where there's been just a ridiculous amount of suffering in the last week, and I don't even know how to put that into words, but Lord, it's just been staring at the news going, how can we, there's too much piled on top of too much already. So I hope you guys are okay out there. By I hope you guys are okay out there, I mean, I know that you're not, but Jesus Christ, it's been another rough week, hasn't it? Just another week in the apocalypse. So it's funny. One of my friends in SciComm, some of you folks out there in New Zealand obviously know her, Dr. Susie Wiles. I saw a picture of someone had memorialized her in this wonderful. They turned her into a Queen of Hearts. Little piece of street art, and I'm like, oh man, they do that in New Zealand to their scientists. Here we wait till they're put under anesthesia to change CDC recommendations. Man, we live in quite the place, don't we? So it's been a week. Christopher, glad you like the eyeshadow. I decided I had green eyeshadow that I'd never used, and it was time to bust that stuff on out. But yeah, it's been a little bit of a rough week. In America, let's see. Adrian said the lip sync's much better this week. Yeah, it's I switched over. Like right now, I'm trying to make sure that I'm on all my possible platforms now, and I'm going through Restream, which seems to be working for me. So I'm glad that this is working. Let's see. Let's see. Keith just asked, can we talk about the batshit crazy change to the guide to get tested? Yeah. So let's just start off right on that. The good thing is, depending on the state that you're in, a lot of states are just going, and not following the new guidelines to get tested. Basically, it seemed like it's how Trump a while ago, and again, you guys know that I generally try to not stick my science dick into politics, but politics stuck its dick into so anyways, Trump a while ago said, and you would think that this would be a thing someone would joke about, like that they would only say as a joke. Trump said that if you tested less, there would be fewer cases, and now he's actually they've decided no testing of the asymptomatic cases, no testing via contact tracing. It's just the amount of testing that they're going to cut down on, kind of to make it look like there are fewer cases. It's really going to fuck up the ability to do the type of contact tracing you need to stop this outbreak. And it seems like basically the U.S. government is trying to go the Sweden route now. So that's horrifying. So I don't know. I don't know how else to phrase it. It doesn't see never mind. They did one good thing. They bought a lot of the $5 tests so that they actually have tests available. But that's not gonna help in a significant way if we don't have the tests available in an immediate sense to test people that are in the chain of transmission and have the asymptomatic cases that are spreading this. So I don't know what they're thinking. It's been nuts watching it. Hi, Robert Clark. It's nice to see that some people are joining us over on Periscope. But man, it's like just watching people. Like it's if you guys have tuned into the RNC over the last few days, I hope number one that you've been smoking a joint or five to cope with that. But number two, they've been acting like the pandemic's over, or like it just never happened. Meanwhile, we've lost, like including the unofficial numbers, like we've easily lost over 200,000 people. Official numbers lost over 180,000 in this country. To try to put this into some perspective, and a doctor friend of mine pointed this out yesterday, from when AIDS hit this country until in the early 1980s until now, 675,000 Americans total died of AIDS in that time. So just think about that compared to the amount of people we've lost to COVID in about 6 months compared to the 40 years, about approximately 40 years that we've had AIDS in this country. It's just, and this is not to minimize the death toll from AIDS, it's to say when people try to minimize it from COVID, it's a little horrifying. So that's how bad this is, and we're still seeing people in politics because this is something to politicize to make their numbers look better. We're still seeing people just writing this off as though it's not a problem, and it's a little horrifying. I don't know how else to phrase that, but yeah, there's no good reason for there's no good reason for anyone who's worked on policy in this country for the last 6 months on this to be trumpeting this as a good job, where the number of fatalities has been atrocious. We had, I think, more cases in, I want to say it was Alabama about a week or so ago than Canada had as a country as a whole. Come the fuck on. Like there's no way that we could, there's no way someone can look at the numbers here honestly and tell themselves we're doing a good job. So it's a little horrifying. I wish it was better. As you can tell, I'm having a day where my brain is just, I'm not having it. I'm guessing some of you guys are at a similar spot, but yeah, so that's it's hard to look at it's hard to look at the people who are currently in charge of the country and who, we're hoping don't win re-election, but, are trying to stay in charge of the country and are pretending that this thing that is currently, racking us, both in terms of our, the upheaval to our normal daily schedules and causing a ton of what are probably going to be long-term illnesses and causing a lot of fatalities. It's strange to just, see them running for office on a platform of we're going to pretend this didn't happen and claiming that they've created 4.3 million jobs by pretending the last 6 months of a net of minus 3 million didn't happen. How do you do that, man? How do you just pretend this all wasn't there? Let's see. Mike Sousa just asked, let's see. Saive, would you be willing to have a 100% lie fireside chat? Just 5 minutes lie to me. I know it would be bullshit, but you want me to try lying for 5 minutes straight? I don't think I can do it. Like I think my brain might explode. It would be difficult. Like if you gave me a series of questions and asked me to make a joke out of all of them, I could probably do it. And just answer dishonestly, but with the attempt to make it wrong answers only. I could do that, but I don't think I could trump up every answer. I don't think that's not a thing I could manage. I hope. But yeah, I don't know about you guys. It's when you go into a grocery store, you're in any space where you have to be in line with someone, or you're up close to somebody that's not in your personal bubble, and you see their mask dropping below their nose. I get a little bit nervous about that, so watching the RNC for the last few days, where people were, I know that they were outside, but being outside and sitting next to someone for a long period of time, that's it's without the masks, your possibility of transmission is still pretty high. So I'm watching that going, oh my God, this might not be a super spreader event, but it's definitely there. If there are people there with this, there's definitely going to be some spread. So I again, like having Trump and Pence a couple weeks ago tell people they should wear masks. It's not helpful if they say this one thing and then tell everyone, we're going to say, hold on a second. If they say this one thing and then they go out and do another and try to say that they've been giving, good messaging, because good messaging in science involves being consistent, and they're just really not being consistent about this. So it doesn't help when they're making it look like you don't need a mask on a regular basis. So, anyways, there's that. So yeah, they waited till Dr. Fauci was out under for surgery to get. He did so much public speaking to talk about the COVID that he needed vocal cord surgery, and they waited till he was under for vocal cord surgery to change policy at the CDC. I don't even. And my camera just turned vaguely orange for a moment. That's how mad I am, I guess. But that's been a little bit horrifying. Let's see. Ruha Gol, I'm sorry if I mispronounced your name. What are some effective approaches / structural changes re-management of the pandemic? Has there been a shift in collaborative / crisis response between research groups? There have been, I believe, some opening up of the way that people are sharing information, like country to country. Like that's been part of the way that they've been able to push through research much more quickly, which has been very impressive. Now I don't know if that's going to continue afterwards. Like the only reason they've been able to research as quickly as they have, and do the type of not just open, like we've seen these there are preprints that are obviously out there fairly frequently, but the public isn't talking about them, the public isn't seeing them as often. But there's it's interesting seeing that that a lot of places are they're sharing the negative results of their research faster. They are trying to collaborate because this is a global effort. But I'm going to guess that this is not as has always happened. This is probably not going to continue afterwards, because a lot of science is there's trying to protect your the work. It's trying to protect your eventual patents that you're working on. So I wish that I could say, yeah, this is going to lead to utopia of sharing all the scientific results, so we can eventually lead to, whatchamacallit, to tricorders and astro boots and all the things in the universe that I want. But I sincerely believe that it will stop very quickly after COVID, because they'll be like, we have patents, we can get out of this. So I wish I had a happier way to end. But no, I mean, we're going to get a vaccine sooner out of it. We're going to get I hope that healthcare will speed up out of it. Healthcare in America, I'm thinking about healthcare in America though. So I wish I had the optimism that I had at the beginning of this. It's melted a little. It's very difficult to try to stay optimistic when it's been a week, hasn't it? Let's see. M. Rosalie commented, fun fact, we've had 34 studies related to COVID that have been recalled or are of concern out of 45,252. That's not bad. That's pretty fucking, so I memean, that means that they're being conducted in a fairly ethical and what's the word, scientifically valid manner. Let's see, Melissa Knock, loving how the futuristic want links to Star Trek with the tricord. It's, what, I had a fun story. I had a boss who, we were interviewing, the potential new boss, and one of the questions that, I looked him up before he came in, and he, we were told this guy is probably going to be hired. We just want you to check out if you like him or not. So I Googled him and found his PhD thesis online, and he mentioned, he compared something to the tricorder from Star Trek. I'm like, oh, I have a Trekkie. So I went, after he gave, his presentation, we had a minute where, we were the only two people in the room, and I asked him, I'm like, all right, I have just one question for you. And he looks kind of nervous, and he's like, what? I'm like, Kirk or Picard? And it's like you get to really. He's like, all right, so Kirk. There's very good argument for, and he gets a great answer out of it. So there's my suggestion for you if you ever have to interview someone, see how they answer Kirk or Picard. It's not which one they choose; it's how they answer it. But also the right answer is Picard. Just wanna throw that out there. There's Buddy is which is your favorite Star Trek series? I have to go with the Next Generation, probably just because it's the one that I've watched the entire thing of. But I would have to sit down and watch all of them in order to be unbiased about my selection. I have no idea when my camera is randomly going very, very orange and then back to normal, or maybe it's just the orange filter is coming off and going back to normal every so often. So. Hold on a quick second. I'm going to scroll through and grab some of your questions from earlier. I've been having a rough pain day for my back, so this is I don't know how to phrase this delicately. I am on a little bit of pain medication, and I'm trying to soldier on through this. Well, it's been a rough day of knowing that I need to get to the groceries Jesus Christ. I need to get to the grocery store and do some things and be functional, and yet I'm lying on the couch going, I just need to, balance being awake and being not in awful, awful pain. So I'm like, if I can get myself through the live stream, I will both be not in awful shooting back pain, and I'll probably be awake enough to go do it. So anyways, thank you for bearing with me. Whilst I'm not at my best today. I'm not at my 100%. So thank you. You are wonderful. So hold on. Scroll through to your questions from earlier. Let's see. Read an article about how the CDC is saying that risk of surface transmission of coronavirus is very low. Any thoughts? It seems to me that's accurate. At one point we thought that surface transmission was the way that people were getting it, and it seems I was paranoid about this too. I was like, you're totally gonna get it from touching the wrong spot in the grocery store. I was afraid that if you went to get gas from touching the the keypad, that was it seems like that's really not the main place you're going to get it. Yes, still, obviously, wash your hands, use hand sanitizer, don't touch your fucking face like I just did if you've been outside. But yeah, that's not, you don't, what I'm saying is don't worry about scrubbing and bleaching down your groceries when you get home. That's going to be just fine. You're going to be okay. But yeah, it doesn't seem like that's the main route by which people are getting it, or that is much more rare. It seems like it's airborne is the easiest way to define it. And we can get into a long discussion about what the definition of airborne is, where the line is between something being airborne and something being, drop, where it's, but basically the way I define it and the way that I describe it for anyone who's, not not a scientist and just wants to know, how do I catch that? If you don't have to touch something, if you don't have to be handling human, bodily waste in order to get it, and you get it by breathing in the air, then the easiest way to describe it is airborne. So that's how I'm going to describe it. Let's see. If someone in a large household gets sick, would having air purifiers be helpful at all in mitigating risk for other household members? The thing that would be most helpful for other household members is having them quarantine to a part of the house that they're not in, and if it's possible for their ventilation to not be shared to the rest of the house. If they have ventilation outside, that would be fantastic. But that's, I understand that's very difficult to share them off. I'm not sure if air purifiers would help. I've not heard in either any way. I've not seen any evidence in either direction. I don't want you to hold off on something just in case it does. But yeah, there's no. I haven't seen any evidence on this one in either direction, but I will have a poke into it for you. Let's see. Somebody asked, how many Jared Kushners would it take to change a fucking light bulb? I would say one, because he would order other people to do it and then take credit for it. So only one. That's my assessment. Let's see. I've read that live vaccines might lower the risk of COVID-19. If so, is there a preference to get flu mist versus flu shot? There doesn't seem to be any evidence Let's see. There doesn't seem to be any evidence that whatchamacallit, that other types of vaccines. Matthew Zacharias. Our comments working through Matthew. Comments are working from every different website today. So right after the last stream, hold on a second. Let me just get this up a little. There we go. Yeah, the last stream, for whatever reason, comments were only coming through from like one channel onto my onto the restream. So now I can see you from every single one, which makes it much easier. But there doesn't seem to be any good evidence that other types of vaccines give you protection from this, and it's like that's a rumor that keeps on kind of cropping up. Like it doesn't give you any significant, like it's not like get your flu shot and you're not going to get COVID, or get your flu shot and there's ample evidence that it's going to lower, the best things that you can do to right now to lower your chances of getting a case of COVID or getting a bad case of COVID. Make sure you're getting enough sleep. Make sure you're getting regular exercise. Wash your hands. Wear a face mask. Social distance as much as possible. And maybe hold off on your doorknob licking habit until there's a vaccine. Like I understand. I want to go back to my Roman orgies too. We'll get there again someday. We'll get there. We'll get there. So it's. I know it sucks. Lots of things about this suck. I'm in it with you too. So let's see. Scrolling through. Let's see. Somebody was asking about aerosols. I think we already mentioned about that. Let's see. Goggles as well. I think so. Let's see. I'm a personal support worker doing community care for seniors. Our standard protocol has been surgical mask, hand wash, and gloves. We just added goggles added as well, even if our client is negative. Just wondering if this is going to really make that much of a difference in reality in controlling the spread. What's the likelihood of transmission through the eyes? Here's the thing. I'm not sure what the exact likelihood of transmission from someone coughing into the eyes is, but that is a known route of transmission. And here's the thing, testing someone and having them test negative, it's not 100% that someone's negative. And if you're working with seniors, someone who's, I don't want to say there's a good chance, but there is easily, a chance that someone could cough on you, and not have the speed, just have a random that's going to hit you, in the eye. And that's a place where you can very easily get a particle of it. So is it a lot? Yeah. Is it overkill? I mean, I don't know. If I knew I was working in a place with a lot of people regularly who are susceptible to this virus, I would probably put on the goggles. So I personally don't think it's overkill, but that's given that you can catch it through this route, I would think about that a little bit, and it's gonna suck. I would wear the goggles though. So scrolling through, trying to have a peek at the comments from this. Let's see. Have you looked at the mast cell mediated component of this yet? I have not yet. I'll have a peek into that. Let's see. How the heck has Trump dodged this virus so far? I mean, a lot of people have dodged it. I have a friend who's been to, who's gone on 4 trips so far. One of them was to a conference, and somehow, here's the thing, it just depends on who you're around and if they happen to freaking breathe on you when they're contagious. So it's that thing where, there are people who've done everything right, who've only gone to the grocery store and who happen to have, gotten the one person coughing in the wrong direction at the wrong time. And then there are people who've been, doing everything wrong and they don't catch it yet. So what does it depend on? Who, if you're around someone with the virus, that's all that matters. So, it's according to him, according to them, it's gonna happen to everyone. So maybe he'll get it eventually. I don't fucking know. I'm not going to sit here on my live stream in which I'm telling you guys about science and wish COVID on anyone specifically. Let's see. Ryan Blackhawk asked about a Nevada man reinfected. So there's been another report that seems like a slightly more reliable report that someone was reinfected. It was a report that in this case a Nevada man was reinfected. So I've seen So this one was interesting. The report that someone was reinfected, like the first case of it. Now here was what I liked about this one. We got a little bit more information on this reinfection. So their first case had some symptoms, but it was still a mild case. The second case of it was asymptomatic entirely. So this and the second time that they came back with. Me stutter pretty day. So the second case, no symptoms, but came up positive. So it turns out that if you have like a less severe case, there is a good chance that there is a chance that you won't form. You can get it again, but you'll have enough antibodies to keep it a mild case. It's hard to tell what's happening with this. I guess it's, we're not going to know exactly what immunity to this thing looks like for a while. Like it seems like the norm is going to be like to other coronaviruses. The norm is having some immunity for, upwards of a year, sometimes up to 3 to 5 years. Like we've seen, some a decently long-lasting immunity, upwards of 3 to 5 years to SARS, the original. This one, it's strange seeing people getting sick so quickly again, and I think we're still figuring out how sick people will get on a second go, or if this is a reserve of the virus in the body. HJK over on YouTube asked, what about T-cell immunity versus antibody? That is a really good question that we've talked about on here a little bit before. So you can test positive for antibodies and have them go back down to nothing. And this is happening a lot. Like people will test positive for antibodies after being negative. They'll be like, oh, I had the virus, and then the antibodies will go down, and they worry that, oh, you're not immune anymore. Thing is, your T cells remember how to make that antibody, and in a lot of cases, that's how it works for all the different things you've gotten. Is your immune system remembers how to make it. So hopefully, if you come in contact with it, a couple months or a year or 2 years down the line, your body goes, got this one, and your T cells start pumping out those antibodies again. And that's what we're trying to figure out is when, how fast does this thing mutate? Will we have to make a new virus in a couple of years? How long do you stay immune to it? All of that kind of stuff. So it's going to be a lot, but no, T-cell immunity is the thing that I think people forget about when they hear, it's easy to associate antibodies as being, the end-all, be-all with immunity. But, there are some diseases that you test for antibodies, and the antibodies don't necessarily say that you have the disease or that you've gotten over it. Like, for instance, I want to say that it's HIV when you test for HIV, and I believe it's for one of the hepatitis, one of the types of hepatitis. When you test for those, there are a couple of different diseases like this. You test for the antibodies, but the antibodies don't necessarily, especially with HIV, they don't actually do anything. So antibodies don't necessarily mean you're immune, and the lack of antibodies doesn't necessarily mean that you're not immune. So it's really easy to look at those and go, they're a one-to-one relationship. But let's, remember we can decouple them and have a look at other things that are going on in there, because not one doesn't equal the other. Anyways, let's see. Scrolling on up, trying to grab a few. Let's see, do we know if it's possible? Melissa Knock asked, do we know if it's possible to contract COVID more than once? Yeah, if you scroll back like 5 minutes, I think that's the one we just covered. Let's see, what about Jared Adams over on Periscope asks, what about plasma donations toward a COVID vaccine? Have there been any developments on this? Here's the interesting thing. It doesn't seem like, after all the research on plasma, because we were doing some work with convalescent plasma. That was one of the more recent arguments with the Trump admin, and it doesn't seem like that's it was being attempted to be, or they were attempting to research it as a treatment for people who were really, really sick. It's like, all right, let's throw some antibodies into people. That doesn't seem to be the way they're going about this vaccine. They have other ways that they can go about, or that they have gone about making this vaccine. It's not as simple as just pumping the antibodies into someone or via via a vaccine pumping an antibody into someone. You want to make somebody produce the antibodies. But in the case of people who are very, very sick, one way that we can, last minute Hail Mary, try anything we can do. That's one thing that they've tried. Now, it doesn't look like after all the studies have come back, it seems like, if anything, a very narrow number of people who they tried in the study and who they counted. It was younger people who were in there who were given the plasma very early, might have had some success with it, and they need more study to find out. But it doesn't seem like something that, as the administration tried doing, it doesn't seem like they needed. It doesn't seem at all like they needed an emergency use authorization for widespread use, and it's not the end-all be-all treatment for this. It's something that might have a small amount of success for younger people who are hospitalized and who are given it early, but it's definitely not it's not a way to go about making a vaccine, and it's definitely not going to be the cure-all for it, unfortunately. Hold on, scrolling through and grabbing some more questions. See, 2 friends of mine have gotten over COVID-19 recently. One is still testing positive, but feeling fine. It's funny, you're going to have people that are testing positive and feeling fine. You're going to have people who are testing negative and are going to have symptoms for months. The thing that terrifies me the most are the long haulers. Like, there are people that got this in March and are still feeling like hell. They're still having viruses every day, myth that are pretty today. They're still having fevers every day. There's still, this looks rough. And it's like, the more I hear about the long haulers, the more this terrifies me, because it's like of all the things that you can get, sick with, just the thought of having a permanent flu, basically, or a permanent flu/pneumonia, like, oh my God, like, and I know this is obviously worse than the flu, like, yes, but like the thought of having a permanent flu-like illness and permanently having a fevers are goddamn miserable. Just think about a good day being a day at which you're only at 101 for months. This is part of the reason why I'm like, I will happily lock down. I will happily skip all the things happily. I'm kvetching to you kind folks every week who will put up with me. So happily is a relative term here. Let's see, Mike D'Souza, friend of the channel, of course, asks, my aunt said COVID-19 is a part of SARS. I said she was wrong because they are in the same family. Doesn't mean that they are a part of one another. Care to answer this more in depth? That is she's You're accurate on this. It's not quote a part of SARS. It is a type of quote type of SARS, I guess is the way to phrase it. So they're very similar to each other genetically, and that's, I think, a way that people can get those two confused. Pardon me. So we have a bunch of different types of coronaviruses. Right now we know of 4 endemic human coronaviruses, or we know of 7 total. So there are 4 endemic ones. Those are your common colds. Then there are 3 that have come out in recent years, and that's MERS, Middle East Respiratory Syndrome, SARS, Sudden Acute Respiratory Syndrome, and we have COVID-19. And COVID-19 and SARS are very similar, very similar genetically. So that's why someone could look at it and go, it comes from it. Like, no, it's not. It is not a genetic, that we know of. It is not a genetic derivation. It's not a fraction of it genetically. They are in the same virus family, and that's it. They are similar in structure. They are somewhat similar. They are more similar genetically than most other like any other viruses outside of the group of coronaviruses, basically. So, like, you can't pick up a filovirus and be like, this is quite similar to, like, it's within the group known as the coronaviruses. These are, like, they are all quite, to a point, quite similar. So you'd have to, anyways, I'm probably botching the explanation after that, but yeah, not taken from it, part of the same group. It's kind of like saying that it would be like saying that humans are taken from monkeys as opposed to being in the same group. Like, sorry, I'm using the wrong primate for that example. Please don't send me hate mail. So that's that. let's see, scrolling back up through and grabbing some more questions. So, Darmento asked, "What are you drinking?" Water. Very boring. Like I said, I need to get to the store so I can get some Diet Coke. It's been a very long day of being a very sore human. Let's see, scrolling up to grab some questions. Someone asked, "Is that a margarita?" I do not drink. I'm very boring when it comes to my beverage of choice. Let's see. Have you seen the studies recommending or alluding to mitigation tactics, i.e., avoiding food allergens or cutting sugar to avoid inflammation? There is no good. Now, here's the thing. There's no good evidence to support that you need to avoid certain foods or have a certain type of diet. However, it does. I'm going to guess that some of those are correlation type things because, like, you can the biggest thing that we found, because early on there was a really strong correlation between high blood pressure and a bad case of COVID-19, either a severe one or a fatal one. And then they realized that people who had a bad case of high blood pressure naturally, but had it controlled, were not having a bad case of COVID-19. So they went back and looked, and they're like, all right, it's the main thing that they kept coming back to with this cluster of symptoms that seemed to link back to COVID was, and I mean, I understand this is a very tough discussion to have, but the thing that it kept linking back to rough cases of COVID was being overweight. That had, and that causes, as a couple of my doctor friends and I have talked about, that tends to cause an inflamed state in the body when you have metabolic syndrome, when you have a couple other things like that going on. So in the case of people, having these diets that are full of sugar, that have and I mean not just sugar, but like a lot of people will blame being overweight on just one macronutrient. I guarantee you, ice cream is not just composed of sugar. There's a lot of fat in it too. I say this as a lover of ice cream, but no, it's not just it's not just the way that people are getting calories. It's the fact that they have. It seems to be the inflammatory state that people are in from having the excess fat on their skeletons that's causing, that's contributing to the chance for a worse case of it, and not the diet in and of itself is what I seem to be getting out of this. So those are my 2 cents on it, and I always leave room for me being just completely and utterly fucking wrong. But I saw earlier today on Twitter someone who's a longtime bullshit artist doctor trying to recommend a diet. You are welcome, Matthew. Trying to recommend a diet book that he'd written to be like, it's detox or whatever it is to get rid of your you can eat like this and you won't get the COVIDs. And I'm like, I'll be nicer about this when you're less dumb. So it was just, I wish the bullshit, like, that they're not going to take a break, but like, you wish the bullshit artists would maybe take a break for a deadly disease. That's like, I'll let them even have their crystals and some of their weirdness. Just stay away from infectious disease. It's killing people, maybe. Okay. Audrey Ralston just mentioned Medical Medium. God, I never even saw that show. It was bad though, right? It was pretty. It's like I see all these. I see all these people that are claiming that they can help, or claiming that they have a cure for this, and it's just why? And I know why. It's because it makes them a buck somehow. But Jesus, hold on a second. Oh, buddy. But he was asking for some attentions. Hello, tiny man. Hello, how are you? But he had to have a tiny bit of his butt shaved. He's like, we've had a. What was that, boy? Did you give me a little growl? No. Okay. He's had a bit of a week. He's had some time. There have been many a trip to the vet. I think it was last week he had his teeth cleaned, and he was. I've never seen this dog so cranky in my life. It's just he's doing better this week, but yeah, there's been between between last week's trip to the vet for the teeth cleaning and the many an effort to get over to get rid of we had to but we had to spray the yards with pesticides. We had to give him extra treatment. It's just. And we had to shave off. There's like one line. He has like a reverse mohawk through the center of his butt. It's just, let's see. Colleen Gallagher asked, is there any legit link to blood type and COVID susceptibility? I've been looking at that, and here's the thing: if the link seems very small, and it's hard. Now, I've said this before, and it's really hard to get distracted by things that you. Sorry. It's hard to get into these things that cause a little bit of an issue, a big issue. The thing that I want you to keep in mind when you're looking at something like how your blood type affects what kind of a case that you can have is asking yourself, how does this affect how I move through the world, right? So if you find out that it's something like, that it's like something like a respiratory illness, and it's like, or it's something like asthma that can cause. I'm going to eventually stop banging into this thing. But if you find out that, having asthma can cause complications and you go, okay, well, I have asthma, I should probably take extra precautions. But what extra precautions can you take for your blood? You're already at this point, you're already taking all the precautions you can. And this only causes the slightest bit, of a chance of there being of a quote worse, case. What I would recommend is take all the precautions you're already taking. Like if you're already in a high risk group and you look at it and go, man, I also have type A blood. You're already probably ordering someone to get your groceries for you. You're already doing all the things to keep you safe. If you're in a low risk group and you the only thing you have going against you is according to all the studies out there is type A blood. I wouldn't take that and go, I have to change my behavior. So, like I said, really hard to figure out which things you have to, really pay attention to, and which things you have to lock yourself into the house and ignore everything else over. But I would say that's a go ahead and keep it in mind, I guess. But I would not change my behavior over the blood type study, if anything. So let's see. Roger Plout comments. I saw an anti-vax quote doctor on YouTube saying that one of the primers to detect the virus has the same sequence as human DNA. There's no understanding of how our PCR works. No. Oh my God. I think the phrase in science for that is not even wrong. It's wrong in a way that that's like saying that Kim Jong-un is the most perfect person who's ever walked the planet because unicorns were born in his butthole. That's just not even a correct that. No, these things didn't happen. I don't know how to. Let's see. All right. So. Anyways, so Clayton Middleton asks, hi, Yvette, long time no chat. I hope you're doing well. You as well. If survival rate for COVID-19 is so high, what's the purpose of a vaccine? Well, survival rate for a lot of things are really high, Clayton. Survival rate for SARS is actually much higher. Survival rate for polio was actually absurdly high. Only 1% of only 1% of cases even had paralytic symptoms. Most polio was asymptomatic entirely. So 1% of something like 75 to 95% of cases had no symptoms, and then there were some cases that had flu-like symptoms, and then 1% encompassed all cases that included leg braces on up to the iron lung, and then a very small percentage of those. It's about, I believe it was about 5% out of that constituted all of the polio deaths. So why did we ever make a vaccine for that? If only 1% of them had any never mind fatalities, had any long-term injuries. I'll tell you why, because it's not just about the fatalities. It's about all the long-term injuries that we leave people with. It's about the long-term health complications. So given that 1% of people are going to die from COVID, and then a much higher percentage of people are going to have long-term lung damage, and we're finding that they're having cardiac issues, and people are having blood clots, and people are having, I could go on with this. there's a good reason that we're making a vaccine for something that is not just killing 1% of the population, which, in case you're unaware of how numbers work, that's a fuckload of people. But it's also going to cause a devastating effect on our healthcare system long term, because we're going to have tens of, depending on how many people it infects until we have a vaccine, it's going to infect and injure tens of millions of people. So yeah, that's why we're making a vaccine more than likely, because lungs are hard to live without. Heard that rumor. So, see. Clayton responds, "This is why knuckle draggers like me ask questions to the much more educated on the subject." Thank you for I'm glad you came and asked, and we're open-minded to an answer. So this is why we have these sessions. My dog is both sleeping and letting out little bitty whines. Let's see. Stephen Reese asked, "So no Jerry Falwell Jr. jokes tonight?" He's in the corner watching this. You're welcome. I do what I got. I'm still stuck on Ben Shapiro jokes, just because, those will never not be funny. How do you self-own that hard? Like I said, I will stop on the Ben Shapiro jokes when he finally gives his wife an orgasm. I will never stop on the Ben Shapiro jokes. Just saying. Let's see. UNO in comments, 4.8% of people have died to recover. I think I'm not sure if I'm misunderstanding how you're stating that, Owen, or if I'm or if it's, let's see, I'm not sure what you're saying by that. Anyways, let's see. Oh man, Ray Arsenal. My God, talking is apparently not my thing today. Ray Arsenal commented, "I have COPD from asymptomatic COVID." Jesus Christ! So that ground glass opacity stuck with you. I think people are like, there was a study that came out a while ago, because I was curious. What the damage was, or if there was damage with asymptomatic cases, because some people were saying, they seem to think that asymptomatic cases were affecting people totally differently. And I thought the way that we could better discuss those was by calling them subclinical, right? Because it's not that these, the viruses are hitting your body, and like the people who get asymptomatic cases, your immune system and your vascular and everything is just, handling it completely differently. It's that your immune system is handling it better than the rest of us in most cases, and you just aren't feeling as sick, but it's going through there and it's trying to do some damage. And it's, in some cases, we've seen those same ground glass opacities, and we don't know if those if those same if with those asymptomatic cases, if they're bad enough, if they're going to stay there forever, if they're permanent, or if they're we're going to be able to re-knit ourselves. So it's interesting. And we saw, there was a study that I read, and it was a fairly early study, but I read it. It was, the problem is there were a handful of small studies that all had a very similar outcome. But it's hard to tell because they're small studies, so I wanted to find more data. But it seemed like, and we keep seeing about 40% of cases are asymptomatic, but it seemed like about half the cases that they found that are asymptomatic come back with negative, positive lung CTs for damage. So even if you don't feel anything, you can still have some damage happening in your lungs, and that's why. And we don't know what percentage of those are going to be fine. So there are people who go to the hospital, very late in very late stages of this, and you've probably heard this term by now, either from me or elsewhere on the internet. The happy hypoxia. Happy hypoxics, people who are so sick and their oxygen saturation has dropped so low, but they can't tell at all, and it's just we're seeing this much more in this than we're used to with, say, the flu. So that's been one part of the nightmare with the COVIDs. So gonna scroll through and try to get some of your questions from earlier. Let's see. Yeah, that's Diane commented the lung scarring thing is frightening. Yeah, I mean, there are a lot of different things with this that are, scarier than you expect from just a plain old respiratory illness. And I've seen it proposed that it starts off as a respiratory illness, so it gets into your system via your respiratory tract, and then it attacks your body like a vascular illness. So it's interesting to figure out, just what type of illness it is. So it's really like, and this is why I keep trying to tell people, think of it like polio. Don't think of it like the flu. Think of it like polio. And it's really hard to get away from thinking of this like, as anything other than a flu, because that's how we think of everything that makes us cough, right? It's like, is it a cold or is it a flu? And this is just its own fucker. Like it's its own little thing. See, Julian Ratliff commented, I ordered myself a pulse ox monitor when you explained the happy hypoxis a few weeks back. Still doing okay here. Good. I ordered and got a pulse ox for my mom as well, because it just, it's like she is in that age group where, even though she is extremely healthy, I think I've joked about this before, like she's so healthy it annoys me. I'm kidding, I want her to stay healthy forever, but she's like, the only thing that's ever wrong with her is she has a knee that's sore occasionally. She's healthy as shit. But I've heard of people, whose parents are healthy like mine, but are, their only pre-existing condition is that they're a little older, and this virus leaves them laid up for months, and that's and that's obviously, like, it's terrifying. So I obviously wanted to make sure that she didn't get this and figure out way too late that whatchamacallit, that she was sick. So it's the first, as soon as I heard about the possibility of someone getting sick and only knowing about this ages into it, I'm like, sending mom a pulse ox. So if you're, if you have someone in your family that is, that lives alone, that is regularly, is regularly exposed to people, see if they have access to a pulse ox. Talk to them about having one in the house. Just they're 35 to 55 on either eBay or Amazon, and they've brought us a lot of the one that we have in this house has brought us a lot of peace of mind, because it's like, all right, I'm having paranoia about this being like, is this the COVID, or is this just that I'm 37 and so I wake up and I'm in pain? And it turns out that I have a lot of days in which I've convinced myself that being 37 and so you wake up and things hurt is apparently a deadly illness. Hasn't been the COVID yet. Has not been the COVID yet. Let's see. Jason Brick commented, general inflammation is honestly a worse thing, is worse than the acute trauma of symptomatic individuals. Causes a high spike in later life conditions that might not be realized for decades. I mean, we're like, right now it is extraordinarily difficult to figure out exactly what the long-term implications of this are, and we can try to project, but we're not going to know. We're not going to be able to figure out what we think is going to happen, at least for a year. So it's hard. Let's see. Colleen Gallagher asks, how realistic is it to get herd immunity in a country as big as the U.S.? Would it take years? Yes, quite simply. So there was. So I read this. I was trying to, figure out a little bit more about, who gets what at what rate, and how, how many cases of them are asymptomatic. And hold on a second. I read a study about the flu, and it turns out in a typical year, a little under 20% of the country, and this, like I said, typical year, so there are pandemic years where it's more contagious. Typical year, only about 20% of the country gets, or 20% of the unvaccinated population gets the flu. So let's take it as though, we're obviously none of us are vaccinated for this. Let's take it, let's pretend that we weren't social distancing at all. We were treating this, like the flu, because most of the time we do not stay home for the flu. Let's pretend as though 20% of the population was going to get this every year. So it could, but here's the thing, with the flu, less than half of those cases are symptomatic. It's very crazy. I was shocked to find out that so few cases of the flu were even symptomatic. So I'm not sure. I believe some of the asymptomatic cases can spread with the flu as well. I've been amazed to find out how many cases of viruses are asymptomatic just by poking around. So it's not really that uncommon with COVID. It's just that we are testing for them now, and we see it happening right in front of us. So it's it's not that COVID is that much different. It's just that viruses are weird, and this is happening in real time in front of our faces. So, yeah, hold on a second, scrolling back up. But yeah, so it would take a good number of years probably to try to get the entire population up. But like, here's the other thing is we are, we're like, if we were, that is if we had everyone just go out, not do any social distancing, take off the masks, and quote try to get everyone sick. But we're social distancing, where people are trying to not get sick. There are people who are going to stay away from humans as long as it goddamn takes, and there are people who are going to form their own little bubbles. So it might, like between people who lose their immunity and are going to get reinfected, between people who are going to die, like it could take, it could easily, take up to, 6-7 years until enough waves of this washes over various corners of the country and people who are trying to avoid other people before we get herd immunity naturally. I mean, it's been the place in the country that has the most infections, I believe, is New York City, and that only has 30-some-odd% that has about a 30% infection rate, and you need about a 90% infection rate before you hit herd immunity. So just think about that a little bit, before you consider, hey, mate, I understand that you weren't asking, hey, let's do this as a thing, but think about how hard it's going to be to get to herd immunity if what happened in New York City was just a third of the way there. We will have to go through that 2 more times in New York in order to get to herd immunity, and that's horrifying. Like that was 2.5 million cases, and I know like the graphs from the beginning of New York, like they look like we had New York and then we had the next spike, which we're in right now. It's gone down a little bit since a few weeks ago, but we had the spike at the beginning of this in New York City was far bigger than what we went through when California, Arizona, Texas, Florida opened back up, and we just didn't have the testing capacity. It's suspected that we had about 2.5 million cases in New York, which is horrifying. Let's see, Dave Thomas commented, if we get to herd immunity in the absence of a vaccine, it means we failed. Exactly. The point is to avoid that. Let's see, Let's see, the herd immunity is a false conviction. The influenza comes back every year because it mutates. You can get this COVID multiple times, so there's no way to believe herd. COVID, here's the thing, COVID mutates much more slowly than the flu, and it also seems to have a fairly, and the spike protein in it seems to be fairly stable, which means we're going to be able to, and a lot of these vaccines are based on being able to make your body recognize and have immunity to this spike protein. So it seems like we're going to be able to make a vaccine in the interim and have something ready and have something coming out every few years to keep up as this does keep mutating, but not aiming for a vaccine and not working on some amount of herd immunity that way seems much more short-sighted than working on one just because it mutates. Like, it mutates, let it win. Pass. Scrolling. Oh God, Doug Ricard comments, there aren't enough refrigerator trucks for herd immunity. Whew, that's heavy. Let's see. This COVID virus has taken us all hostage. It's taken my sanity, that's for sure. Let's see. Someone just commented, some recent studies suggested herd immunity might... No, that is not accurate. Some recent studies suggested herd immunity might arrive with infection rates as low as 20 to 50%. No, it won't, because infection rates are already above that in New York City, and I can guarantee you if New York City opened tomorrow, people would get sick again. That's not how herd immunity works, and if you're claiming that, or if a study's claiming that, it doesn't. It's lying to you. Sorry. So... Hate to. It sounds like it could be good news, but that's not. Like, you would need a minimum of 70%. I would be surprised if it's anything below that, but 20%. LOL. We've already seen cities that are higher than that, so that's not how this works. So good. Pardon me. Good wishful thinking, though. I'm on board with you with that wishful thinking. So, I see Dan Keeling is if this is going to need an annual vaccine, would it be able to be combined with and administered together with the annual flu vaccine? Depends on the type of vaccine. I'm not sure. Like it's. Depends on the kinds of adjuvants it needs. Depends on the kinds of things that it needs to stay stable. I'm not the right person to ask about this. I should probably get a vaccine expert on to chat about that a little bit more. But that's something that I'll have a poke into a little bit. But there's a very different reason why we have an annual flu vaccine versus why we might need a regular COVID vaccine. The reason why we get an annual flu vaccine is that the flu mutates. The reason why we might need a regular, and I mean an every 3-year COVID vaccine is what I'm guessing. The reason why we would need a regular COVID one is that we lose our immunity, not that the COVID virus itself mutates. Now, there's a chance that it's going to slowly mutate, and it looks like it would probably mutate about every 3 years because that seems, again, like it mutates much more slowly than the flu. So we will see. It's a little ways down the line. Let's see. I see Akiko Abe, I think that's how I pronounce your name. I apologize if I'm getting it wrong. I see that you linked to hold on a second. I'm going to try. I can't click on this. Gosh darn it, because I'm clicking out of, I'm trying to click out of Restream. But I will try to have a look at your link later. I see it's a Washington Post article, the Brazil coronavirus herd immunity. I'll have a peek at that later. I promise you. I can't click on the screen. Let's see. Someone said, "Oh, good, SARS 23." Yeah, maybe. Who knows? Someone told me you have to get a COVID vaccine every month. No, you will not need a COVID vaccine every month. Like it's, and I mean, I get it. We keep hearing these reports. Like it seems like every other week we hear a report about, people. It's just the viral fragments that are testing positive, and then we hear another report the following week saying that someone got reinfected, and it's this is why I just kind of every time I hear another report, I come with it back to you, and I say the best thing you can do about this is try really hard not to get sick. Because we don't know which one it is. We don't know if they're getting reinfected. We don't know if it's a reserve of the virus. It's there's a good chance that some people have gotten reinfected, and there is a good chance that some of these people are just getting sick with this infection that they've had in them the whole time. So the best thing you can do is try really hard to not get sick, which I get it. That's hard to do with this thing just kind of being airborne death. So let's see, scrolling a little bit. Let's see, scrolling. How's this week in the apocalypse treating everyone? Someone just said we just need to pray. That worked really well for Jerry Falwell, I'm sure. Rebecca said, these weekly chats have turned into my knitting project time. I'm glad I can be useful for helping you. Is it what are you making? I want to know. I need to know. I'm glad I pronounced your name correctly, Akiko. I try. I try not to fail. I think I have. I think I'm good at the throwing a dart at it with the name pronunciation, but it's like I said, there are times of awful failure. Let's see. Oh, making a shawl, very nice. Mento Darmento. If I toast my bread, will it kill the Rona? Only if there's the Rona on your bread. But I have no idea either way. Clayton asks, let's see, apologies if you've already addressed this, but HCQ thoughts if already addressed disregard. We haven't talked about it today, but let's get our last. Let's give our let's give the eulogy for HCQ. May it rot. May it go back to just being an anti-malarial and a treatment for lupus and RA. It was interesting because the FDA came out. I want to say it was it last week or was it this week? Like it's all one apocalypse. But the FDA came out and said, we're once again doesn't work. And Donald Trump came out and was like, many people have said this works for. It doesn't work. It does not work. It does not work. It hasn't been shown to work early. Hasn't been shown to work late. Hasn't been shown to work at a high dose. Hasn't been shown to work at a low dose. it does not work. So, please, it's don't, no matter what you see some jackass saying in a YouTube video, and I get it, I'm a jackass in a YouTube video, there's no good reason to suspect that hydroxychloroquine is a preventative, is a treatment, or is a way to, someone said, did you say HCQ? Or ICQ. I meant to say HCQ. There's no good reason to think that hydroxychloroquine is going to in any way help a case of COVID-19. Let's see, Owen comment asked, what is your position on people wearing masks? I think people should wear masks. I think that they are going to help cut down on transmission on this, and I hope that you guys will. Will vaccine be safe since it's being pushed through so fast? So there are the vaccines that I'm suspicious about are the ones that we're using that we're using the population as a way to test, and that's not happening in the U.S. Like they're doing legitimate phase 3 trials over in the U.S. Like as right now we have the Moderna one, we have Pfizer, I believe. I'm a patient at Kaiser, and Kaiser is doing. Hold on a second. I'm sliding off of my chaise. I'm sliding. Too many pillows. This is the danger of sitting on atop far too many throw pillows. Ladies, just try to hold yourself back next time you're at IKEA and you're like, I want 17 of those. You will fall off your couch. Just saying. It's cozy though. Anyways. But yeah, let's see, where was I before I just, got myself off track, because that's the thing that I do. Oh yeah, vaccines and being safe because they're coming out early. So the ones that, we're researching a handful in the U.S. right now that are going through phase 3 trials, and phase 3 generally has, it's going for some of them. They're going through. They're testing it on 30,000 people. That's a lot of data. So the main stuff that they've pushed through or they've rushed through faster than usual is the type of testing that they're retesting things that they've already tested in other vaccines. So it's like, hey, we've used this antigen in other vaccines. Let's make sure that it's safe when we combine it with this for this vaccine. They're kind of skipping over stuff like that. So I wouldn't be worried, given that they're doing the same amount of testing. They've tested it for safety. They're testing it for safety and effectiveness in the same number of people that they always do. And they're also going to have it go through what we call the vaccine safety data link, where they do post-market monitoring. So as it's going out to the population, they're making sure that they haven't, even though they've already checked on 30,000 people, they're still going to be looking to see if they miss, if there's anything, because you expand from 15 to 600 for phase 2, and then you expand from 600 to 30,000. You might find more effects in 30,000, and then you expand from 30,000 to 7.7 billion. What are you going to find for side effects in that people? Because you're going to find more people with more, with different, I don't want to say different anatomy, but, different potential health problems, and you never know what's going to come of that. So that's why we have the vaccine safety data link, to see what else might happen. And they're actually more thoroughly monitored than drugs, which I think that people who are anti-vax don't, they either don't know that or they like to deny it. But no, they're very heavily monitored. I wouldn't trust the one that was just released in Russia. There's one, I think it's called Sinovac, that that China's basically using the Chinese military to, for their phase 3 trial. And it doesn't seem unsafe, but it also seems like the effectiveness is I don't want to say questionable. It's effective in some people. Basically, it depends on if you've had this certain adenovirus, like because they've built this virus based on they built this virus on this other adenovirus, and your body can latch on to the adenovirus part of it as opposed to the coronavirus part. So it's interesting to see which one. That's going to, like I said, about half the people are going to at least half the people that get it seem to be getting some immunity to the COVIDs. We're not sure how well it's going to do overall though, so I don't have a ton of faith in that one, but better than nothing. Also seems to be safe, but there are more trials going on around the world with that one, so that's where we are with that. I would not. I would not trust that one for. I would trust it for safety. I wouldn't trust it for efficacy. I wouldn't trust the one out of Russia with anything. Maybe there's plutonium. Who knows? Let's see. People are discussing. People are asking what stars are. So quick note. So this week, tomorrow specifically, is the patron only live stream over on Patreon. I have the link to it in the description of this video, as long as I set up Restream correctly. If you guys would like to come join for my Patreon monthly Patreon only monthly live stream, because there are very much fewer of you guys. It's very very small, intimate gathering of friends. Tomorrow at noon PT is a Patreon only live stream, so come join patreon.com/SciBabe if you would like to help keep the pirate ship afloat here. But also, if you're looking and going, what are stars? If you would like to just, if you want to help keep the pirate ship afloat and you don't want to leave Facebook, you can, 1 star is 1 penny, and if you want to throw me a few stars, I appreciate that. But also, you guys are, it seems like it's about time for one of those weird things where I lick the screen because it's the apocalypse and there are no rules anymore. So here we go. I don't understand my life either. It's the apocalypse. There are no rules left. I'm glad you enjoyed this, Clayton. But there we are. Ooh, there we go. But yeah, it is a strange apocalypse, and I'm here for it. I know normally I go for 2 hours for these things. I'm probably going to cut it off at about 7 because I am, like I said, it's been a long day and I'm tired and in pain. I'm also going to be doing this on Sunday. Also on Sunday, I'm going to have a guest, not doing a sciencey thing. It's been a hard week. I feel like everyone is having a rough week, and I'm bringing a comedian on, my friend Steve Gadlin. If you ever watched Shark Tank, and you remember the guy, I want to draw a cat for you. He is the cat drawing guy, and he is going to be. I've had him on my podcast. He is just a delightful person. He's very funny. We're just going to come on and have some. Have some amusement and have some giggles, and I hope you guys enjoy them. But yeah, we're just like I'm trying to have one guest on per week and try to keep it a little light. I'm working on a SciComm guest that you guys have requested a few times. It's just schedule is tight. I'm trying. So if you guys have people that you want me to have on here, let me know. Slide into my DMs. Oh, also, if it's pinned to the top of the page on the Facebook page. But if you guys want to come and join the Discord server for Chatskis, there's also like I said, pinned link on the top of the Facebook page. There's a link to the Discord server, and we're just in there chatting, and there are memes, there are pictures of cats. Come join. Anyway, so let's go back to trying to finish up a few questions here. So again, you got one last time. If you guys want to join over at Patreon, there's chatting. There's gonna be another stream tomorrow. I'm gonna be doing so much streaming the next few days that I'm not gonna remember how to talk. My tongue is clearly it is at the end. It's Lauren, your guess might be correct. It might be. That's a possibility. It's Doug. You just said Iowa has a 79% positivity rate. Where is that coming from? It's not that I'm second guessing you. I'm just like, that's crazy. That's how do you fuck that up? Like, are they only testing people like after death? I mean, Jesus, that's crazy. Scrolling through and trying to find a few more questions. I can't tell if it's just I can't tell if I'm causing the low energy today, or if it's just been a really. Someone asked what time is the stream tomorrow? Tomorrow's stream is at noon Pacific time. So come join. Really, let's see. A lot of people are asking about air purifiers. Karen Thomas asked, are air purifiers helpful at all when there is one household member who's positive? I think this was a question in the in the pre-stream questions. I have yet to see any studies on this either way, and I try to go by what the studies say, and I mean, intuition makes you go, yeah, maybe, but it's really hard to like it's. again, it's hard to say when it's something that's moving the air around, like, because it's ventilation systems that are like, especially when you hear about restaurants, it's ventilation systems that are moving the air in a closed environment. So if you have someone in the house who's positive, I would try to make sure that their air is not going into the rest of the house. So if you can make sure that they're venting to the outside as opposed to into the rest of the house, that would probably be the best. People are asking how to get to the stream tomorrow. It is a Patreon only stream. The link is in the description of the video, patreon.com/SciBabe. I might even do an eyeshadow makeup tutorial on the thing, because that gets requested sometimes. Let's see. Gallagher, Howie Mandel, Andrew Dice Clay would be nice guests for the apocalypse. I'll see if I can get. Let's see. Let's see. Garrick said having your comedian friend on would be therapeutic, because laughter can be the best medicine. I've got a lot of comedian friends. I'll see if I can get some of those on, because, giggles. Those are in short supply lately, as the country is having a bad. I'd say having a bad week, but it's having a bad existence. So things could be better. All right, I see your post about about positivity antigen rates, Doug. I'll have a poke at it later. Let's see. Ooh, that is good news, Jordan. Pumpkin spice is in less than a month, right? Things are looking up. I'm excited about something. One thing in an otherwise dark and dreary world. And so this is a really good question. What's the doctor recommended amount of time daily for screaming into the void about everything terrible? I don't think there's a limit. I think that's just. I think you can do that forever. Mike D'Souza said if you get Fauci, that's 100,000 stars. I have tried. I've actually emailed him and asked if he would come onto the podcast, or onto the live stream. But it seems number one that it seems he's busy, but also now he just had vocal cord surgery. But Dr. Fauci, I'm here for you. You can say anything you want. You won't be silenced. You can tell the truth about science on my little live stream. I would like some Dr. Fauci on here. That would be great. Stacy just asked, "What's your meal plan? You look fabulous." My meal plan lately is just it's half the time I stress eat and half the time I stress don't eat, and that kind of works out to me eating enough. So there's been it's been very hard to like I'm not a paragon of what you should be looking up to in terms of your diet, but lately it's been this has been some good advice, because like I've been trying to avoid going inside. I've been eating a lot of stuff that I can get from a farmer's market. So lately it's been a lot of fresh fruits and vegetables. So that's been nice. But I'm very bad at having like a steady, like this is what I'm always doing. Because there are definitely days I'm having a bad mood and I'm going to have ice cream for breakfast, lunch, and dinner. Like, it's the apocalypse. I definitely bought a giant thing of powdered cheese. I have no regrets. Let's see. So a couple more questions in here. People are suggesting. Lindsay Lanier asked, "What about the guys from This Week in Virology?" I will definitely shoot them an email. They can explain the stuff that I'm trying to explain far better than I explain it. I will try to get them on. Let's see. Kelly Hall commented, "The conversation in GIFs on Discord is fun." There is a channel on my Discord server that's just a conversation all in GIFs. Please come join. Let's see. I assume licking the doorknobs is not recommended presently. Don't crush my dreams. Don't lick doorknobs for like a little while more. Just work with me on that. See, what Ray said, "What the hell is powdered cheese?" If you've ever had Kraft dinner, i.e. mac and cheese from, my dog is whining about nothing. Yeah, powdered cheese. I'm just saying, it's, you feel like you're going to regret it, and then you don't, and it's delicious. I did it. I feel not bad at all. See, Doug Ricard said, if you scream into the void, will you develop nodules on your vocal cords and all of your programs will be changed while you're sedated for surgery? It's a possibility. I feel like I feel like I'm developing nodes in my vocal cords just from the vocal cord collapse that I'm going through right now. Like, speaking this low is not good. Speaking this low is not good for my vocal cords, period. Let's see, scrolling through. Let's see. Somebody is making fun of my saying GIF as opposed to GIF. I'm just saying the person who invented them called them GIFs, and so I will call them GIFs as well. That's just them be the rules. Let's see, scrolling a bit more. Someone asked, get the Dr. Norman Swan on. He's the father of Jonathan Swan. Norman Swan is a really amazing science communicator from Australia. I will shoot an email and see what I can do. I don't know if I'll be able to get him, but I will see if I can get him. People are telling me now powdered cheese is acceptable. Look, I have tried some strange things for foods during the apocalypse, because one of my fears has been that we will one of my main fears has been, I'll get the COVID and I'll get the type that makes me lose my sense of taste and smell, and I won't be able to eat anything fucking delicious and bad for me with a sense of joie de vivre for a long time. And I'm like, fuck it. I know I'm going to gain a little bit of weight and I will enjoy it. And so beginning of this, I just stress ate. And I told you guys, if stress eating helps, do some fucking stress eating. And I stress ate at the beginning of it. And now I have stress lost my appetite, which is annoying because I have to, when I stress lose my appetite, I lose it hard. And it's like I have to eat in order to take my meds. And I want to be hungrier than I am. So it's like it's not stress losing my appetite in any comfortable way. So it's sitting there getting a stomachache because I haven't eaten and being like, I need to be hungry now. So that's that. Don't hope for. Hello, Oliver. Do you have anything to say? Hello, hi boy. He's a man of few words. But yeah, that's that is the hard part with it's like I said, when it's emotional eating can go in both directions for me. So having it go to the stress in the opposite direction is just it's rough. But yeah, my it's Mento Darmento asks, is stress eating healthy? Probably. Here's the thing, it's eating can be healthy or unhealthy depending on what you depending on what you're eating and the amount that you're eating, and if you act in a healthy manner afterwards, if you're if you're exercising enough, all that good stuff. But it's having no appetite is rough because you're like, you need to eat a certain amount of things. You need to have some food in your day. So that's I just wish that I could, I wish I could not be stress eating and not, like I said, just have a normal appetite all the time. That would make my life easier. Hold on a second. So how I've been telling you guys that there have been parties in my area, and I think I posted about them. There have been there have been some outbreaks in the USC area, and they're right in my freaking neighborhood. I can hear partying starting up, and it's not even 7 p.m. and the partying is starting already. I'm terrified to, I'm not terrified to go to the grocery store, but the last time I went to the grocery store, just so many USC students. They come back and this is what I don't get. There are next to no classes happening at USC. Most of them are happening remotely, and yet it's so many of them have come back just to have the campus experience, just to be in the area. Really? It's part of me does not blame the students, because the students should not have been put into this position at all. Period. But it's you at the same time, you're responsible for your behavior. I get it. You can't expect someone below 22 to have upper level reasoning and understand this whole risk. I can't look, if you're watching this and you're in college, I'm sorry. I'm just saying you don't have the reasoning skills to go, this is a risk that can fuck up a lot of things yet. And some of you might not be out there partying and spreading the Rona, and I'm obviously not talking about you. And then there are all the assholes in my neighborhood that are spreading the Rona nightly. So it's a bit much. Adam Smith just asked, I'm new to your stream. How long have you been doing this? Since the beginning of the Rona, about 5 months. This is new. I'm getting used to this, as are most of you guys. So yeah, it's rough hearing it every night. Like, everyone in my house has been so good. Like, I live with 10 people who have all been so good about, not going out, about wearing our masks, about, doing all the things that have, changed our lives for the more, for the less convenient. Half of the house is musicians, and they've had to, give up everything that they do normally to network, to rehearse, to make a living. It's been hard to, watch. Like, it's been really hard to see this happen. Like, one of the outlets I work for shut down. I used to do, about half my work was going to conferences and speaking, and that's gone. So I mean, this is not like, it's not just, it's not me looking at these kids going, why aren't you behaving? I had to give up nothing. Like, we all had to give up things too, and we've been able to do it. And gosh darn it, we would like to be out in the world having our lives too. But we made sacrifices because we wanted to keep, the people in our community, the people in our house safe. And hearing it every night on our block and seeing seeing that the numbers are jumping in our neighborhood because these kids are out partying is it's disheartening. It's like, I know that other people have made the analogy before, but it's like, it feels like we're the only kid working on the class project. Like, what's the point? What's even the point of doing this when like there are people that are just going to keep messing it up every just all constantly. It's just continuing to happen. It's hard to watch. And it's like a continuous slow moving train wreck that's going to keep on happening until both we have a vaccine and Trump is out of office. Oh my God, this is going to be horrible. So yeah, I think I'm gonna try to draw this to a close nowish, because it's been about an hour and a half. I know I'm going a little short today, but I'm gonna be streaming for the next 3 days. So it's gonna be a lot. I'm gonna be tired. There's not gonna be any talking left in me by Monday. Lillian said, I feel like I'm in perpetual gaslighting. Everyone seems to not care and are partying. I want to watch zombie movies to help keep my resolve. You know what? I wrote an article for Self on how watching zombie movies at the beginning of this kind of helped. Because it seems like zombie movies are really outbreak movies, and zombies, or the zombie virus, they function like a contagion. And they did bring me quite a bit of comfort, going, we know how this goes, and there's going to be an end to it sometime eventually, and it's going to be hard in the middle, but we're gonna get there. But you're not wrong for feeling gaslit. Watching people watching politicians who we didn't all vote for, let's be clear. Watching politicians who a lot of people in our country voted for, just say straight into the camera that act like this is over while it's killing people every day, act like they did a good job while we saw refrigerated trucks fill up with bodies. It's galling, and it's not only galling, it makes you question your sense of reality, which is the point. Like, if they keep lying enough, it's not an attempt to get you to believe the lies. It's an attempt to get you to not recognize the truth when you see it. It's an attempt to get you to not believe, not trust anything or not believe anything, and that's why. That's part of why propaganda is so effective, and they have been using propaganda effectively, and it's not just about COVID, but about a lot of things. And I'm sad for the country. I'm sad for how this is working out, and I really I wish that this never had to be so bad. this whole thing from start to finish, we never had to be in such a disaster with testing. So many people didn't have to get sick in every single wave. It's the communication on this from top to bottom never had to be so awful. And I'm quite sure literally anybody would have handled this better as president. And it's scary. So I know I'm ending this on such an up note, right? So anyways, someone said I think QAnon is Putin. They actually found out the guy who might have been QAnon is actually like the owner of either 4chan or 8chan. Like that was I want to say his name was like something like Jim Watson. Like that was the nuttiest thing. But shocking that he also is wanted for, I believe, child porn, which is just interesting that they're spreading rumors about everyone in Hollywood being a pedophile when this guy owns a kitty porn collection. Anyways, but yeah, so I understand the world is on fire and it's terrifying and horrible and it's everything kind of sucks right now. But look, we've got a few things we can do to try to take care of this. Number one, take care of each other, your families, your kids, make sure everyone in your life is wearing a fucking mask when they go outside. Watkins was the last name, Jim Watkins. Thank you. Make sure your kids are ready for school and that if they have to go back, that they understand that mask has to stay on, that they're not swapping it with their friends. Hope you guys are safe out there. If you're in a part of the country that is having some upheaval, either via weather or via cop that doesn't understand you're not supposed to shoot someone in the back 7 times, I hope that you guys are safe. I hope that you guys are taking care of yourselves. I will see you guys. If you guys are on my Patreon, I will see you tomorrow. Otherwise, I will see you on Sunday. Please stay safe out there. Get some sleep. Play some video games. Do some comfort eating. Do what you have to do. I know it's not just a rough time. It's extra rough right now. I can't wait for this to be over so I can hug you all. Take care of yourselves. All right, guys. Have a good weekend or have a good set. I will see you guys on Sunday. Bye, guys.